A few weeks ago, Shirvo and I received some DNA test results revealing how our genes can shape certain personality traits and quirks. But a pilot study out of Monash University has taken this one step further.
Testing 10,000 young adults for increased genetic risk of certain conditions, the groundbreaking research identified more than 200 participants who were flagged for early intervention and screening.
For more, we're joined by the co-lead of the study, Dr. Jane Tiller, live in Canberra. Morning. Let's start with our results. Can DNA really tell us about our personality?
Good morning and thanks for having me. The kind of testing that you did, we like to call recreational genetics. And these are things that, they're interesting. We saw in the segment that it was things about, do you like coriander and what kind of exercise might you be good at? And these are things that have sometimes a bit of evidence behind them. It depends on the test that you're having. Sometimes they check out, sometimes they don't. But as you mentioned already, what we're focused on is trying to help people find out about their disease risk, and so we can use that to prevent disease and save lives.
Yeah, it seems to be where the technology is going, doesn't it? Does this and these results influence certain aspects of our lifestyle? Will it make a change, do you think?
So the kind of testing we're doing is for what we call medically actionable disease risk. And this is people who are at very high risk of certain cancers and heart disease, things that they can prevent or treat early if they're able to catch it. And these are people who are at up to 70% risk of some cancers. So there are some lifestyle changes that can be made, but really for these kind of people, it's about having interventions in the health system, having early screening and surveillance. Some people have medications that they take. Some people even choose, like Angelina Jolie did, to remove their breasts or ovaries altogether to reduce their cancer risk.
OK, Jane, the big question I would think is, if you have this done, do you have to declare it for your health insurance, or can they access it?
So health insurance isn't affected by this. We have community rated health insurance in Australia, which means they don't change the cost of our premiums based on health risks. But life insurance companies absolutely can. This is something that's been of big concern to people and something that people are worried about. We've been campaigning against this for a long time, and last year the government actually announced that they would introduce a legislative ban to stop life insurance companies discriminating. Obviously, that hasn't happened yet. We're in caretaker period at the moment with the election due on Saturday, and we're hoping that the new government, in whatever form it takes, will act on that promise and introduce that legislation really quickly.
It's remarkable. It's kind of gone cure, prevention, pre-prevention. Jane, thank you so much. Congratulations on the work.
Thank you.